So as most of you know, 60 Minutes with Angela also focuses on health issues. And today's program is a response to those of you who have asked for me to focus on some more health issues. Today we're looking at the eye. I'm here for my yearly eye test, and we'll see what this test reveals about my eye. Join me again after the break. Well, hello and welcome. This is 60 Minutes with me, Angela Ajitomobi. Thank you for joining me on the program today. Now, my host today graduated as a medical doctor from the College of Medicine of the University of Ibadan in Oyo State, that's Nigeria's former Western region. She graduated in June 1984 and started specialization in ophthalmology 2 years later, that's in 1986, a journey that has taken her to Stanford University in California, the United States of America, Moorfields Eye Hospital in London, United Kingdom, hospitals in Italy, Belgium, and Germany. She's a member of the Royal College of Ophthalmology of the United Kingdom that she became in 1990, and in 1999 became a member of the American Academy of Ophthalmology. She commenced subspecialization in 1999 in the field of glaucoma. Today, she's a member of the Ophthalmology Society of Nigeria, the International Glaucoma Association, and the former American College of Physician Executives, now known as the Association for Physician Leaders. Currently, she is the medical doctor of St. Edmund's Eye Hospital, established in 1966 to provide quality eye care services at affordable fees. She's also a consultant ophthalmologist at the Eye Foundation Hospital in Ikeja, a suburb of Lagos State. So, join me after the break. I'm counting down 60 minutes with Dr. Ayodele Harriman, consultant ophthalmologist. Welcome back. Welcome, Dr. Harriman. Thank you very much for coming on the program.
You're welcome.
Now, I brought you on the program today because I get a lot of letters from people on health matters. We've never looked at the eye, and that's why I brought you here today. The first question, I suppose, is why the eyes? Was it because your dad was also in the eye field?
Well, I decided to do eyes soon after my youth call. Initially, I thought of doing forensic medicine, ear, nose, and throat. But after youth corps, somehow I just decided I'll do ophthalmology, that I'll do eyes.
Yes.
And my father had already set up the practice. So I thought I might as well do something there and along that line.
Okay. Is this field for every doctor? And I'm asking you that because I've watched cataract surgery being performed, and it seems to me that you need very steady hands to be able to do surgery on the eyes, and that tells me that maybe not everyone will be cut out to be an ophthalmologist. Would I be right?
No. Any doctor can be an ophthalmologist if they so choose, if they're interested in ophthalmology. Now, in places like Europe, we do have medical ophthalmologists, but in Nigeria, we tend to have medical and surgical ophthalmologists. Right. Medical ophthalmologists do not operate at all, but you're right, your hands have to be steady if you're doing ophthalmology, if you're an eye surgeon. Okay, so in other words, you can just be an ophthalmologist and then refer the person to the surgical person. You can.
That will operate. Yes. All right, so generally speaking then, how should we care for the eye? And I'm asking that because I've heard of all kinds of things that people use to wash the eye, so to speak. Substances like water, engine oil, if you have some kind of conjunctivitis, and all these old wives' tales. So take us through how generally we should care for our eyes. People should care for their eyes from birth. The nursing mother has to watch what she eats. She has to make sure she doesn't have any infections, takes the normal immunizations that she has to take during pregnancy, goes for her normal antenatal care, because the baby can contract
an infection in the womb, and such infections can affect the eyes. Also, if the mother is diabetic, it can affect the baby and also affect the baby's eyes.
Yes.
Then even as children are growing up, when the baby is born, sometimes they put sugar solution,
Yes.
breast milk. Breast milk per se does not have any harm, but sugar solution can affect the eyes even at birth.
Right.
And sometimes some native medications are placed on the eyes, and these tend to affect the eyes.
Yes.
Now, as children are growing up, the parents have to make sure that they don't play with items that have sharp ends, and they don't throw stones, because these can damage the eyes.
Have you seen things like that with broomsticks and
Yes,
stuff?
broomsticks. Children are sword fighting, in quotes, with
Yes.
broomsticks.
Okay, you say sword fighting,
Yes.
you know, with the broom.
Yes, with the broom, and somehow the broom injures the opponent's
Yes.
eye. Or a teacher beating a child
Yes.
with a cane. Well, now they call it child abuse, but
Yes.
in those days, teachers used to beat children,
Yes.
and sometimes the cane hits the eye as the child is dodging.
Yes.
So that can also damage the eye. So teachers also have to be careful while beating children,
Yes.
so as not to injure the eye. So care also has to be taken at that stage. Children playing football as well, or throwing stones, using catapults.
Yes.
Yes, those can damage the eye.
Irreversibly?
In some cases, irreversibly.
Like if a broomstick, the example you use, sword fighting,
Yes.
and the broomstick pierces the eye, will the child go blind in that
The
eye?
child can go blind because broomstick carries fungi, germs called fungi. And those fungi get into the eye
Yes.
and cause a nasty infection.
Okay, so it's not the piercing of the eye with the stick that may cause the blindness, it's the
It's the
infection.
piercing. Well, the piercing leads to infection, introduces infection into the eye.
Okay.
So that can lead to blindness, because fungal infections of the eye are very difficult to control.
If anyone is watching us now, you've just had a newborn baby, what are the things to look out for? I've heard it said from some people that babies born with big eyes, you know, people tend to say, Ayodele, you know, like the baby is really pretty. But I've heard it say that that can be signs of something negative.
Yes, you are quite correct. Such a condition may be just an abnormally large eye, or worse still, may be due to glaucoma. So some children can be born with glaucoma. And in glaucoma,
Yes.
the pressure of the eye is high in babies. And that tends to enlarge the soft eye of the baby.
So what did you specialize in? Is the eye just one thing, or there are many aspects to the eye?
But there are many aspects to the eye. I
Okay.
specialize in glaucoma.
Okay, and glaucoma is the one that they say it has no cure,
Precisely.
but if you catch it early,
You don't need to go blind. I always tell my patients that they don't need to go blind if you catch it early and you treat it properly.
is it your experience that, generally speaking, people run away from accepting diagnosis of anything that is wrong with their eyes?
It used to be the case, but not now.
Okay.
People are more aware of diseases like glaucoma,
Yes.
cataract, other diseases. So they're actually more careful now.
Are you catching them early? You know, when I speak with doctors who are doing breast cancer, for instance, they keep talking about patients not turning up early enough and sitting at home. They go to the churches, they go to pastors, they go everywhere else but the hospital. That is not the experience you are having.
Well, we do see some cases that we catch or we diagnose when they come for a routine eye check. Some people come in with a past family history. They
Yes.
say, oh, my parents have glaucoma. I just want to make sure I don't have it.
Yes.
And for quite a number, it's late. They have advanced glaucoma.
If your parents have anything wrong with their eyes, they wear glasses, they've had cataract, they have glaucoma, how soon should one be checking these things to say, you know, it may be in the family?
I tell people from 40 years of age, make sure you have a check. But even if you're 35, still have a check. If you're 20, still have a check.
Right. If you see taxi drivers who are old and they're not wearing glasses, should we be worried?
No.
Not everyone who's old will wear glasses. You know, I'm talking about those old babas who drive taxis. I remember when Lagos State first started this driver's license thing and were insisting on tests.
Yes.
One of the things they found was that a lot of the older taxi drivers were going around either blind in one eye or with reduced vision.
That is true.
So if someone is elderly and he's driving and he's not wearing glasses, should one be alarmed?
In present day Nigeria,
Yes.
yes. But if he's had cataract surgery,
Yes.
he might have lens implants that allow him not to wear glasses.
Right. In which case, he won't need glasses to see.
In which cases he won't need glasses to drive because his vision is perfect.
Okay.
But majority should wear glasses while driving. And I've seen so many drivers
Yes.
that need to wear glasses but confess that they don't wear glasses while driving.
Why not?
They say it's heavy on their eyes or it casts a shadow. It's just not the same.
So, wearing sunglasses, for instance, is not a luxury, it's a necessity, would you say?
Not in all cases.
But we shouldn't let the sun hit our eyes directly.
Yeah, because we're in the tropics. So the effect of ultraviolet light also on the eye can lead to diseases like pterygium, which is a growth on the surface of the eye.
Wow, looking
Yes.
directly at the sun.
Not looking directly at the sun. If you look directly at the sun rays may make a hole in your eyes, a macular hole. And that's why when there's an eclipse,
Yes.
we're told not to look at the sun.
Are you serious? This is interesting.
So it can burn, it can make a burn
Yes.
in the macular area.
What do they call this now?
This is an eye model.
Model of the eye.
Yes.
Okay, so take us through the different things you've spoken about.
The eyeball is round. It's within the socket, within the bony orbits
Yes.
there, but it has three coats. It has an outer coat called the sclera, which is what people see
Right.
when they look at you. Then it has a middle coat, which gives the color of the eye. So in some people, the eyes are brown. Some people have blue
Black.
eyes. Some have dark brown eyes, green eyes, depending on your pigmentation.
Right.
Because that second layer of the eye
Yes.
is pigmented, has pigments.
Right.
Now, the front part of that second layer
Yes.
is called the iris. Okay. And then behind that
Yes.
is what we call the ciliary body.
There.
And then further into
In.
the eye is called the choroid. Now, this is the vascular layer of the eye, or the blood
Supply.
of the eye. Then we have an inner layer which is called the retina. The retina is the light sensitive layer of the eye. Now the macula I mentioned, it's a depression
Yes.
in the retina. That part of the eye is what we use for distinct vision. For me to look at you and see your eyeballs,
Yes.
my macula has to function. For me to look at a letter and it is T,
Yes.
looking at it directly, my macula has to function. So if one looks at the sun for a long time, the light rays come to a focus on the macula
Yes.
and can make a hole in the macula, can make a burn in that macula
Burn
area.
that. And what would be the effect of that? Blindness?
Partial blindness. I use the term partial blindness. If that happens, if I look at your face, all I'll see is a blur, is a circle, is a blur. But beside you or round about you, I'll see you, I'll be able to see your dress, but I
Yes.
won't be able to see your face. I won't be able to see your eyes, your nose,
features, the
your
fe-
features.
Yes.
No, I wouldn't be able to do that.
Okay. You also talked about when babies are born.
Yeah.
You know, can you use this to show us what, you know, one should be worried about if a baby is born with big eyes?
Now, if a baby is born with big eyes,
Yes.
the baby's eye tends to expand when the pressure of the eye goes high,
Yes.
because the sclera is soft.
Right.
That is, the white of the eye is soft, unlike in an adult.
Yes.
In an adult, if the pressure of the eye is high, it's just transmitted to the softest part of the eye, which is at the back of the eye, where the nerve is.
Yes.
And it tends to damage the nerve and affect the blood supply to the nerve. But for the baby, the eye starts expanding. And because the pressure also still increases, the front part of the eye,
Yes.
that should be clear, like a clean window,
Yes.
starts becoming cloudy. So over time, initially everybody says, oh, beautiful eyes, big eyes.
Yes.
But over time, if that child is not treated,
Yes.
if it is glaucoma, then the front part of the eye starts becoming cloudy and watery.
And would the mother know, would the parents know?
Well, the mother always knows there's something wrong.
With the eyes, she
Yes.
can see that it's...
She can see the eyes don't look normal. So initially she may observe, but soon after, within a few days, or
Yes.
even sometimes day one of birth, she shouts out and lets people know that there's something not right with the eye. And usually babies should be examined immediately after birth.
Yes.
If they are properly examined by a pediatrician or by the nurse,
Yes.
the nurse should be able to see that there's something wrong with the eyes. Sometimes babies also have a discharge at birth,
Yes.
and they get such an infection from the birth canal of the mother.
If a child is not focusing, you know, you walk past and the child doesn't go with you, that should also give you a sign that something is wrong.
Yes, yes, because from 2 weeks, the
Yes.
child starts looking at the mother when she's breastfeeding.
Yes.
So the mother notices, oh, this child doesn't look at me.
She's staring
And
but not looking
The
at
baby
it.
isn't looking at her. Normally babies will look while they are sucking.
Yes.
You know, but this baby just doesn't look at her. So she knows that, or she senses there's something wrong.
Yes.
Sometimes babies are born with crooked eyes, which we call squints.
Yes.
Sometimes they are born with an opacity, a white opacity in the eye.
Yes.
And as we also mentioned, sometimes they are born with large eyes with glaucoma. So they can be born with congenital cataracts. Sometimes the eyeball itself looks normal from the outside, but there's a problem with the nerve at the back of the eye. Sometimes there's a problem with the retina, even at birth. So the child doesn't see properly.
Would you operate a baby who presented with congenital cataracts though?
Yes, babies can be operated on. We have what we call pediatric ophthalmologists who have specialized in children's eyes.
Right.
And they are the ones who operate on babies.
Okay.
Yes.
Okay. So how will I know that I need to see an ophthalmologist like you?
Sometimes you don't know you need to see an ophthalmologist, but if you have a family history of any eye condition, it's natural to say, oh, let me just make sure I'm okay. I don't want to lose my sight.
Yes.
As people approach 40 years of age, they find that they can't read small prints. So they tend to go for an eye check and
Yes.
find out what exactly is happening.
Okay.
Those that have had injuries before. But usually it's people who are catching up in age, who are getting older, that just feel they need to have an eye check. Some parents bring their children for eye checks because they have they wear glasses.
Right.
Or the teacher has complained that the child doesn't see
see.
well or is not doing well in school. Or sometimes if children complain about headache,
Yes.
the parent brings the child for an eye check.
Okay. Okay, so we'll do my eye check now and then we'll decide if I need any more help with my
Hopefully
eyes.
not.
Hopefully not. So join us again after the break.
Who knows sabi better thing? Abi who no like better thing? All these fine things wey dey see so. Na money government dey take do am now. Abi, as in, it's like, I mean, excuse me, I dey pay my tax. I dey do wetin? I dey pay my tax. Say you don't pay your own tax. Have you pay your tax?
Pay your tax. It's your civic responsibility. It's your duty. It's the law.
Well, welcome back. If you've just joined us, it's 60 Minutes with me, Angela Ajitumobi. On my hot seat today, Dr. Ayodele Harriman, a consultant ophthalmologist, and I'm just getting ready now for my eye exam to see if I have any issues. Well, hopefully not. Dr. Harriman will be taking me through my paces. I asked her, how does anyone know that they need an ophthalmologist? Welcome back, Dr. Harriman.
Well, thank you, Angie.
Okay, so should I take off my glasses
Well, not yet.
Okay.
Because I'm going to check your vision
first?
first.
Ah, okay.
I'd like you to look in the mirror, straight
Yes.
ahead.
Yes.
Okay, can you see the big letter there?
I can see the big
Okay, I'm
one.
going to ask you to read all the letters that you can see.
Okay.
Okay, so I'm going to cover your left eye.
Okay.
And, okay, start reading.
E, D, N, H, C, U, O, L, A, F. D, something, E, something, N. Then the next one is E, F. Can't make it out, no.
Okay, then. I'd like you to put this as a pair of glasses over your nose. There are
Okay.
small holes there. I'd like
Yeah.
you to look through.
Okay.
And let me know what you can see.
Right. DHLEN, CTPALO, DNHOBUC, POTABRLD.
Okay, can you read the very last line?
Uh,
Okay, not to
UL.
worry, you're still within the normal range.
okay. UL. That's all I can
Okay,
make
that's
out.
good. That's very good.
Okay.
So we'll do the second eye now.
Okay.
And let's start from the end.
Okay. DN, HCU, OLAF, DHLEN, CFPALD. Oh, no.
Okay, I'd like you to put this on as well.
Okay.
So hold it over your nose. Can you make out those small letters?
DNH, DBUC, FOTABELD.
Okay, what about the last line?
No. FL, no.
Okay, you have a pair of glasses.
Yes.
I assume they are bifocals. They're very focals.
Yes.
Yes,
For
okay.
both eyes.
For both sight and reading.
Yes.
Okay, good. So put them on now. Let's see if
Okay.
they are working effectively. Let's start from there.
Okay. OLAF, DHLEN, CTPALO, DNHOBUC, POTABELO, ULCEHB. That's it.
Okay, what of now? Can you see those last
Yes. ULCEHDTH.
Okay, that's very good. So your glasses are still effective. I'll test you with the reading test types.
Okay.
Okay, I'd like you to hold on to this.
Yes.
So which can you read comfortably at this distance?
I can read the first.
Okay, go ahead.
Now we have reached the trees, the beautiful trees. Never so beautiful as today. Imagine the
Okay,
effect.
that's good. So your glasses are still okay. Okay, so I'm going to examine your eyes.
Okay.
I'm going to shine light on your eyes. I'd like you to look straight ahead. Okay, look up. Look down. Look at my light. Just look at my light. Look at my light. Look at my light. Look at my light. Look at it this way. This way. Look at my forehead. And now look at my light here. Good. Okay, that's good. Oops. Okay, it's your shoes. Okay, I'd like you to lean forward. Place your chin there. I'd like you to rest your forehead against the bar. Good.
Yeah, like that.
Yes. Are you comfortable?
Yes.
Okay. So don't mind the bright light. I need the bright light to be able to see into the eye.
Okay.
Okay, I'd like you to look at my ear. Okay, good. Sit back. I'm going to put drops on your eyes
Okay.
so that I can check your eye pressures.
So that means, do you support women putting false eyelashes on?
It enhances their beauty. But there's a special glue that is used.
Okay.
And if that glue gets onto the eye,
Yes.
it can damage the cornea, it can cause an ulcer, it can strip off the superficial lining of the cornea,
Okay.
and cause a lot of pain and watering of the eye, and even an infection.
Right. So it's not advisable. I've never seen you wear false lashes, so that tells me something.
I don't think I'm inclined that way. I love my lashes as they are. So I'd like you to look up,
Okay.
all the way up. Just think a bit for a few seconds. Okay, think a bit for a few seconds. Okay.
Whoa. Do I keep it closed?
Yes, just keep it closed for a few seconds, and then soon after blink.
Now, what is this eye drop for?
Now, this is an anesthetic eye drop.
Right.
It deadens the surface of the eye. So even if I use a pin, the pointed end of a pin on your eye, you won't feel a thing.
You're kidding me.
I'm serious. So, okay, open the eyes, blink a few times. It's going to water, so you can use the tissue
Okay.
to mop the excess tears.
Okay. And put my chin back.
Yes, please place your chin there. Rest your forehead against the bar. Has it stopped stinging?
Yes.
Okay, put your chin down. Good. Rest your forehead against the bar. My instrument will touch the surface of your eye, the cornea that I showed you. It will not scratch or damage your eye. I'd like your cooperation in keeping your eyes open, though. Nothing to be afraid of. You won't feel a thing. Just concentrate on my ear.
Okay.
Good. So if you can keep it open, all well and good. So that way I don't need to touch your skin. Okay, that's fine. Okay, blink
ear.
again.
Whoa. That's scary. Look at your ear.
Yes, look at my ear again. Open wide if you can without blinking. Okay, that's excellent. Your pressures are excellent. Just one final test.
Okay.
So I'm going to hold this lens in front of your eye. Very strong light will get into your eye. It may be a bit irritating. So you can blink just from time to time. Try not to blink ever so often.
Okay.
Look at my ear again. So this helps me to see the interior of the eye.
Are you seeing the nerves and stuff?
Yes, I am. Okay, that's fine.
So is it at this
So I'd
stage
like you
you
to
would
sit back.
see if one had cataracts and glaucoma?
No, it's at this stage I might see glaucoma,
Right.
looking into the eye. In some people with glaucoma, the pressure of the eye is normal,
Right.
and the normal range is between 10 and 21. But for the average population, it's usually about 13, 15 millimeters of mercury.
Right.
So your pressure may be normal, you may have no complaints, but if I look at your nerve,
Yes.
then I might see signs of glaucoma. But a cataract I'll easily see from here.
Okay.
Yes.
So this is just one stage.
This is one stage. Then after this,
Yes.
I'll have to dilate you. That's put drops, dilating drops. Those drops dilate the pupil. The pupil is the diaphragm, is the hole in the iris.
Right.
Remember I showed you the iris, so the pupil is a hole in the iris, so it makes it wider so that I can have better visibility of the back of the eye.
Okay. We've done the first stage. At this stage,
Yes.
what's the prognosis? I don't have any problems
No,
with my eye.
no, your eyes are okay. I'll leave you for a year because you've reached the mature age.
Yes.
I'd advise that you come back in a year's time to have another check.
Okay.
So at least once a year, once you are found to be okay. Like this, I cannot see the periphery of the retina. So it's only when you are dilated that I'll be able to see all this,
Yes.
this part of the eye,
Okay.
to make sure there are no holes, no degenerative changes there.
In
Yes.
there.
Yes.
What I've just done with you now is the basic eye test.
Yes.
Generally speaking, if anyone did that, they would pick out things if you had problems.
Oh, definitely,
But
definitely.
if there were more problems, it wouldn't end here.
No, it wouldn't.
All right.
Yes, we'll put dilating drops to widen the pupil of the eye, and the pupil is that black area.
Yes.
Within the iris, and when that is done, it will give us better visibility to the back of the eye and to be able to see the peripheral retina.
Yeah.
We have a gel-like substance in the center of the eye.
Okay.
We call it the vitreous gel. Sometimes there's blood in there, sometimes there are inflammatory cells in there, or sometimes when there's infection, it's also cloudy, and one will not be able to see to the back of the eye.
Okay.
Now, there are other tests that need to be carried out. One is a visual field test.
What does that do?
The visual field is what is your field of vision, and that's, in simple terms, that means your space of sight. Now, everything you see around you
Yes.
is in your space of sight. Now, when a visual field test is done, we look out for anything affecting the brain, we look out for glaucoma, depending on if there are any blind areas in your space of sight. So that will be shown on the test.
Will
And
be
that
revealed.
assesses, yes, so it assesses the integrity of the nerve of the eye.
Right.
Okay, we also do an OCT, which is optical coherence tomogram. If a person has a problem with the macula, an OCT can be done.
Right.
And that scans the retina. Because the retina is transparent, anytime we look into the eye, we just see through the retina
Yes.
to the middle coat of the eye. But the OCT gives us the different layers of the retina. The retina has 9 layers,
Yes.
and it shows us those layers and shows us where there's a problem.
If
Yes.
there is a problem.
If there is a problem.
Okay.
Yes.
Now, just doing my eye test with you now, the basic eye test, what would you have seen that would make you determine that I need to have my eyes tested further than this?
If there's a problem with the nerve. If I looked in and I saw there was a problem with the nerve,
Yes.
or if I looked in and I found that I couldn't see the nerve, then I would assume that there's something happening in there.
Would this have revealed if my lens was cloudy, if I had cataract? Would you have seen it at this stage too?
Yes, if you have cataract, I'll definitely see it at this stage.
Okay.
Definitely.
All right.
And depending on how dense or how opaque the cataract is, just shining light on the eyes may even allow me to see the cataract, because I'll be able to see the opaque lens through the pupil
Right.
there.
Of the
Yes.
thing. Okay, so this is interesting. I mean, how does one get cataract? How does one get glaucoma? Are these things preventable? I think we'll talk about that when we come back from the break. So join us again after the break.
Government wants our city to become a mega modern city. And so, government is providing modern markets for us to carry out our business. Now, this requires money. So we need to pay our taxes to help government to help us. I pay my taxes. I hope you've paid yours.
Welcome back. My concluding moments now with Dr. Ayodele Harriman, a consultant ophthalmologist. Okay, now I know that here at St. Edmunds, you specialize in glaucoma, cataracts, diabetes, and floaters and flashes.
Yes.
What are floaters and flashes?
Floaters are black objects that the patient sees or that the person sees moving about when he looks left or right.
Yes.
And they are suspended in space. In fact, many people describe those floaters as cobwebs. They say they see cobwebs. Some say they see dots. Some say they see curling figures. And anytime they want to catch them, some even use the term mosquito and try to catch them.
The mosquito?
Yes, and try to catch them and find out that they can't catch it, and they keep on seeing the floater. The floater is actually from the gel of the eye, from the vitreous gel.
That's the gel you were saying is in the middle part of the eye?
Yes,
Okay.
yes.
And what are flashes?
Flashes are exactly as they are described. They are like a flash of light. They are like lightning, and that's what the person also sees. Now, a flash of light is caused by a pool of the gel on the retina. So now the vitreous gel
Yes.
has attachments in particular areas, the gel within it.
Yes.
It's semi-liquid, but it has attachments like a net to different parts of the retina.
Right.
To the peripheral retina, to where the optic disc is, which is what forms the optic nerve, and also to the macular area. Now, over time, this gel tends to separate. Those attachments tend to separate from the retina. And in the course of separating, they pull on the retina and cause this flash of light. Because as I said, the retina is the light-sensitive layer of the eye. So it pulls on it and causes this flash of light, which some people describe as a circle. They say, oh, they see a circle of light. And it can be an ominous sign for retinal detachment. Because sometimes when the gel separates from the retina, it causes a tear on the retina. And fluid, the liquefied gel, can pass through that hole and separate the retina from the middle coat.
Will that lead to blindness?
Retinal detachment will definitely lead to blindness if it is not treated.
When you say detachment, so what is the treatment? To reattach?
It has to be reattached. Sometimes it's not a full detachment. It's just a slight partial separation. In which case laser energy can be used to stick it down. But for most cases, surgery needs to be done. Definitive operation needs to be done. And that is by the retinal specialist.
Right.
Yes.
Well, that's not your field.
No, that's not my field.
Okay.
That's not my field.
If people watching us now experiencing these symptoms, floaters and flashes, there is treatment for it.
No, floaters don't disappear. They are usually permanent. But after some time, the person might not notice them unless he looks for them. And that is if he juggles his eyes, he may see them. Because over time, the vitreous gel completely separates from the retina and just settles.
In there?
Yes, it settles in there. The structure of the gel just settles in there. But if the person juggles his eyes around, then he will see the floaters. So after some time, some people say they don't see them. The flashes of light also tend to diminish as the gel separates further. Flashes of light does not always mean a retinal detachment, but we do look for a tear in the retina or a hole in the retina if a person complains of flashes of light after seeing floaters for a while.
Yes. Okay. And, you know, from researching on this eye thing, I found that the eye cannot be unconnected with other parts of the body. So how does diabetes, for instance, affect the eye? It
is said that the eye is the window of the body. So as diabetes affects the eyes, it also affects, it gives you an idea of what's happening in the rest of the body. And diabetes tends to affect the small vessels. So those vessels tend to leak.
Yes.
And when those vessels leak within the eye, they tend to affect vision. Because as I said, the retina should be transparent. There should be nothing in there except the blood vessels on the surface. But where you have abnormal vessels within the eyes that are leaking.
What are they leaking? Blood?
They are leaking substances from the blood vessels, usually lipids, fatty substances tend to leak out from those blood vessels, and they tend to be deposited in what we call the macular area, and that tends to affect one's vision. Those abnormal vessels can also bleed, and when they bleed, they can bleed into the retina itself, they can bleed into the gel of the eye, and obviously cause a reduction in vision. There are injections that can be given into the eye that will prevent the growth of these vessels. Laser treatment can be given, or definitive surgery if there's a lot of blood on the inside of the eye.
When you say injections, I shudder to ask where you want to inject in this eye. Is it
into
the white part?
Through the white into the eye. It's usually painless, or the person just feels a small pinch.
Will they be awake?
Yes, they'll be awake.
So
but anesthetic drops
like
would
what
have been
you
put
to
on
me
the eye.
earlier on.
Yes.
But I will see the needle approaching.
No, well, we actually ask the person to look in a direction. So it's
to deceive us.
Well, not really to deceive, just to expose that part of the globe better. And then
I can't believe it. Well, okay, with cataracts, causes, symptoms, treatment, complications. I've heard that trauma can cause cataract.
Yes.
Must you have cataract in both eyes?
Not necessarily. If you have severe trauma, severe injury to the eye, yes, you can end up having a cataract.
What's a trauma? A blow to the head?
No, to the eye itself.
Itself.
Yes, not to the head, to the eye itself. That can damage the capsule of the lens. Water or fluid that is within the eye leaks into the lens, and the lens becomes opaque.
Right.
So trauma can cause that. Trauma can also dislocate the lens into either the back of the eye or to the front part of the eye. That's
Remove it from its original position?
Yes, depending on how severe it is.
And if it moves from that position, will the person see before getting to you?
The person will notice that his vision is blurred and will obviously be in a lot of pain. Then I was going to mention earlier that diabetes also tends to cause early cataracts. Yes.
When you say early, what is early? What age?
If a person is diabetic at 40, he's more likely to have, if his diabetic state isn't controlled, then he or she is more likely to have cataracts at that age. One expects to see cataracts if it is age-related, 60 upwards.
Right.
But by the time a person has a white cataract or a mature cataract at a younger age, you usually like to check for diabetes.
Does that complicate the treatment of the eyes if one is diabetic going forward now? You've established that there's a problem with the eye, but the person is still diabetic.
The blood sugar has to be controlled, usually before any form of operation is done on the eye, because they are prone to bleeding, they are prone to infection.
Right.
Diabetes means sugar. There's a lot of sugar swimming in the blood, floating in the blood.
Yes.
And germs love sugar.
Right.
So
that's the attraction.
That's the attraction, yes. Wow. And then there's also poor wound healing, because they are also immunocompromised. They are prone to infection, and there's poor wound healing. The wound just takes longer to heal. Yes.
Now, what will be the symptoms to look out for cataracts?
The person complains that his vision is blurry. That's first. Or there's glare. He can't stand light, or when he sees oncoming lights, the light is scattered. Yes. And if it's left for too long, those are in the early stages. There's usually gradual deterioration in the vision until the person can't see at all. Right. And by the time the person can't see at all, you have something like this, a white cataract.
Oh, you can't see through it at all.
Many people cannot see through it. Some may be able to perceive light, but they won't be able to see faces through this type of cataract.
Right. Okay. So
we have different types of cataracts.
That's a complete one.
Yes, this is an overripe cataract. It's
overripe.
Or a hyper mature cataract. It's a very mature cataract. A nuclear cataract, because the lens has a nucleus. Right. So sometimes the nucleus becomes cloudy. Some people can still see through this. Right. Some people say, okay, I can't see in the distance, but now I don't need my glasses to read. So usually this type of cataracts helps them to read without their glasses.
Is this the one they say you don't have to operate?
We do have to operate on all cataracts.
Right.
All cataracts eventually need to be operated on.
They get worse?
They get worse with time.
Okay.
Usually they increase with time, or they become denser with time. Okay. And once the quality of life is reduced, then one should operate.
Okay. And that one, this one?
Yes. This cataract, this is a cortical cataract. It's in the cortex of the lens. Right. But as you can see, the center part of the lens is quite clear. So the person may not even notice that he has a cataract because the pupil, he can see through that. So, and such people, you just leave them alone until they complain
that they can't see.
That they can't see, by which time the cataract would have extended to the central part or the axial part of the lens.
Do people run away after coming to you for a consultation and you've established that they have one of these cataract conditions? Do they run away because of fear of the surgery? Some
you don't see again. Some go away until the cataract becomes hyper mature, over mature. And that is understandable, because if I'm told I need surgery, I'll be scared.
Yes.
But if everything is explained to me, the procedure is properly explained to me, I'll go and think about it and come back and have the surgery.
What does the surgery entail? Where do you cut and what do you put in?
Okay. Now, there are different types of cataract surgery.
Right.
There's what we call small incision cataract surgery. It's a small opening just through there. A tunnel is created into the eye, and the lens is brought out.
Okay.
But there's also what we call phacoemulsification, which the layman calls laser cataract surgery. Very small incisions or openings are made into the eye,
Right.
and a probe that is about the size of a needle is passed into the eye to break up the lens and suck it out. So ultrasound energy is what is used to break up the lens, even though they call it laser cataract surgery.
Right.
See,
So
but it's
instead of bringing
definitive
it
surgery.
out whole,
Yes,
it breaks it up into little bits.
yes, and sucks it. So that's modern cataract surgery. But the latest, the technology is already in Nigeria,
Yes.
but isn't widely used in Nigeria, is
Yeah.
what we call real laser cataract surgery. And laser energy is used to break up the lens on the inside of the eye, but you still have to go in there and suck it out.
When you say go in there,
But that means you still have to go into the eye to where the lens is and suck out the broken pieces.
will you be asleep?
No, you'll be awake. The good thing is there's very good anesthesia that can be given around the eye. And you can talk to the person during surgery.
Wouldn't they be blinking and, moving and...
No. By the time they have good anesthesia,
Yes.
usually they shouldn't blink and the eye shouldn't move much. The eye may move a bit,
Yes.
but not much. And even there's what we call topical anesthesia, like the drops I put on your eyes.
Yes.
Surgery can be done with
With the
topical
one.
anesthesia.
You
Yes.
mean after putting those drops in my eyes, you could have injected me and done more things?
Yes.
Okay, let's talk about glaucoma before we go. No cure for that.
There's no cure for glaucoma, but it can be controlled. And usually I tell people that just as diabetes and hypertension can be controlled, glaucoma can also be controlled.
Right.
The most important thing is having the pressures. It's easy to manipulate the pressure and get it to such a low level as to reduce further loss in of the space of sight, of the field of vision.
And that brings me to my last point, on the last note. This story from a friend of mine, a group of people watching television, and one of them just screams and says, NEPA, like electricity had just been turned off.
Yeah.
And everyone was sitting silently in shock because there was electricity. Why would one person think they'd suddenly taken the light?
Because there was a sudden loss of vision. And that can occur in cases of hypertension. It's like having a stroke of the eye. So it's either the blood vessels within the eye go into spasms, in which case we call it a central artery occlusion, central retinal artery occlusion. And that may be caused by cholesterol plaques flowing through the vessels, or just the vessel going into spasms. Also, if the person has a sudden retinal detachment, that can also cause that. If a person bleeds in the brain, in what we call the visual cortex,
Yes.
there might be a sudden loss in vision.
Can that vision be restored?
As the blood clears, it can be restored, but not fully. It's never the same.
It's never the
It's
same.
never the same. And in some old people
Yes.
who have inflammation of some of the vessels, more so the temporal artery, they tend to have what we call an arteritis or giant cell arteritis.
Yes.
The small blood vessels supplying the eye might be affected by their arteritis, get occluded, and there's a sudden loss in vision.
So it's not something they sent to you from the village, like juju or something.
Juju does exist, but it might be the symptom of that. So usually I still listen to the patients, but I don't brush it out. I
Brush it aside.
No, I don't brush it aside.
Yes.
I listen, but I try to treat the symptom of that.
You try
Yes.
to look at the medical angle.
Yes,
You
and
must
treat
have
that.
heard all kinds of things about the eye,
Yes.
all kinds of old wives' tales here. People coming and refusing to accept that there's a problem with the eye.
Yes. There's always some form of denial.
Thank you very
Yes,
much,
my
Dr.
pleasure.
Harriman, for coming on the show.
Thank you very much for
And I
having
hope
me.
everyone today has learned something about the eye. You can like 60 Minutes with Angela on Facebook or follow me on Twitter. Thank you for watching. I'm Angela Ajitumobi.